Are you getting back pain when you're bending forwards? If you are, then you should probably watch this video because I'll talk a little bit about that today. But before I get into that, make sure you hit the subscribe button somewhere down here, which will make sure you stay up to date with all of our latest videos and other bits and pieces that we put out on a regular basis. So first of all, what is the role of the back and what happens when you bend forwards? So your lumbar spine through here is the main weight bearing structure of your body, and all the pressure from your upper body goes through that spine. And it should be nice and vertically aligned so it's upright. And it's got the capacity to bend forwards, bend backwards, etc. But when we bend forwards, we shift weight invariably onto these discs on the front here. And we stretch some of the structures on the back. When we bend backwards, we do the opposite. We put pressure on these little joints on the back here, which are the facet joints, and we stretch the discs a little bit. Now, bending forwards, what are the problems with bending forwards? Well, if you have some low-grade disc injury, and that's not necessarily to say you've got a huge, raging prolapse driving out towards the back of the nerves like so, but if you've got some strain on those discs, maybe one is a little bit more worn than the other or under a little bit more pressure for a number of reasons which we get into in some of our other videos. But as you bend forwards, you increase the pressure on the front of this disc here. And those structures on the back, which are under a bit of pressure, start to stretch and give way. And if a few of these fibers are a little bit torn, then it's going to exploit those fibers and that's going to give you that pain. Think of it like a water balloon. If you squash down on the front of the water balloon as you bend forwards, the balloon bulges backwards, and that creates pressure on the wall at the back of the disc or the back of the wall of the balloon, and that can then give you that pain. And then when you have to come back up, not only have you got the increased compression, and you can test this at home. If you take your rucksack or your bag and you carry it out like that, you'll find that the weight magnifies the further it is away from your body, which is why lifting technique is taught to be hold the weight closer to your core, because it doesn't magnify the weight. So not only are you bending forwards like so, you're increasing the compression, you then activate your muscles to pull you back up, and that further compresses the spine. Now, if you don't have the normal alignment and a few other things, then you make this 10 times worse, which may be why you particularly are suffering a little bit more with back pain when you bend forwards. But the easiest way to understand this is go and see a practitioner. Get them to have a look at your back, whether it's an osteopath, chiro, or a physio, someone who's got the time to actually look at you, not in a 10-minute appointment, but a slightly longer one, like what we do here, and fully understand the stresses and strains that your back is under. And generally speaking, they will advise you to avoid doing those forward bending exercises. Now, there are certain examples where people will say, actually, do you know what? You should do a forward bending exercise, maybe lying on your back doing knee hugs. And the reason for this should be explained to you. Because when you do those knee hugs lying on your back, which is a sort of bending forwards, you're just in a different position, it opens out this little space on the back here and creates less pressure on this nerve, takes some of the pressure off temporarily. But of course, we know that bending forwards or doing a hugging of the knees up like so will create pressure on the front of the disc, and that again can do the same things that I've already mentioned in this video, put pressure on the back part, which means that it doesn't actually help you in the long term. So be very careful with what you're doing, but firstly, avoid bending forwards. Go and see someone who can actually properly evaluate your spine if this is an issue that's been going on for a longer period of time. Try your best when you do bend forwards to keep that natural arch, that natural backward bend in your lumbar spine, and use these little things down here called your hips to actually bend from those as you're supposed to do, rather than rounding that back. Sometimes I get patients that come into the clinic and I say, okay, can you show me how you bend forwards? And then you go like a fishing rod. It's terrible for the back, and correct technique, correct form should really be taught and understood. When you bend down, you bend from the hips, not from the back, and that will also protect you when you are bending forwards, because at the end of the day you've got to tie your shoelaces. Doing it correctly with good form can protect your back so you're not causing quite as much damage when you do bend forwards, and you find that a lot easier. Thanks for taking the time to watch this video. For more videos like this and recent uploads, click the link up here. If you want to learn more about our Back in Shape program and how it can help you from home, then click the link here. And remember, to stay up to date with all the latest videos we post, subscribe by clicking the button above my head. Thanks for watching.